Hello, everyone. Let's study chapter 19. So, let's talk about the respiratory tract. Respiratory tract can be divided to upper respiratory tract and lower respiratory tract. Upper respiratory tract is from the nose, mouth to the larynx. Okay, so the lower respiratory tract is from the trachea to the alveoli. Now, so for the nose, so the nose have the nasal hair. Nasal hair can trap the particles. Okay, can filtrate the air. Also, so the interstitials in the respiratory tract has the cilia. Okay, cilia can can filtrate the air and catch the bacteria and propel the particles bacteria to the larynx. So, so this is actually also it can secrete the mucosa. So this is the first line defense. So the respiratory tract also have the second, third line defense, such as the immune cells, also the antibodies and complements. Now let's work on this. Which structure in the respiratory system is attached to the alveoli? So I give you 5 seconds. So the correct answer is C, bronchioles. So respiratory tract has all 1, 2, 3 defenses. Okay. Also, there are the beta in the upper respiratory tract. So we don't know if there is a beta in the lower or not until now. So the beta in the upper respiratory tract. So these are the Streptococcus pyogenes. Okay. Um, uh, Haemophilus influenza, Streptococcus pneumonia, and Neisseria meningitis, Streptococcus aureus. Actually, those are the normal beta. However, if so due to some reasons, so this bacteria can cause diseases to us. Also, we also have the fungi such as Candida albicans. Okay, so if our immune activity is decreased, so those can cause trouble. So if the patient have the respiratory tract diseases such as COPD, asthma, so their biota actually change. Okay, smoker and non-smoker have different biota. So the normal beta actually is very important because they can construct an ideal environment for our hairs. Okay, they can limit the pathogens growth. Okay, decrease the chance for the pathogens induced diseases. So this question, which bacterium is completely found in the normal biota of the upper respiratory tract? So I give you 5 seconds. So the correct answer is C. Okay, it's C. C is very common. Now let's talk about the different diseases. First is pharyngitis. So the symptom is pain, inflammation, redness, swelling of the pharynx. Okay, sore throat is due to the swelling. Okay, So it can be caused by both bacteria or virus, okay, mm, such as the common cold, okay. So it can cause mechanical irritation. So, so the agents that cause this problem is the Streptococcus pyogenes, group A Streptococcus. Uh, so this bacteria is gram-positive coccus grows in chain. Okay, uh, no motile, can form a capsule. So this facultative anaerobe, okay, that doesn't produce catalyst. So actually, this bacteria can cause severe trouble. Okay, it can cause scarlet fever, such as so this induced by the Streptococcus pyogenes infected with the bacteriophage. Okay, the symptoms would be so it can produce a rhizogenic toxin. Okay, the symptom is the sandpaper-like rashes with the fever. Fatality rate is very high, and rheumatic fever is also one severe consequence. Because so this is autoimmune diseases because the bacterial M protein similar to the heart muscle, so it cause the heart inflammation. So the M protein actually mimic heart muscle protein. Okay, can cause rheumatic cardiac diseases. So since the bacteria has the capsule, so the capsule is made of the polysaccharide. Okay, so this can protect the bacteria from destroying. Okay, that's why actually it's relatively difficult to treat this bacteria. Lipotecoid acid. So the bacteria use this to attach to the epithelial cells. Uh, so M protein actually resists phagocytosis. So bacteria also has hyaluronic acid. So it contributes to the addition. So this is group A Streptococcus. Okay. So this is peptidoglycan. Okay, and cytoplasm. So strep it has streptolysin O and S, can cause beta hemolysis of the sheep blood agar. Okay, it can secrete a rhizogenic toxin, so it can cause the bright red rash, induce fever. So 30% of those may be the strep. Okay, strep. So that's why if the patient has sore throat, so normally the health care provider will do a strep test. Okay. Um, so the transmission is through the respiratory droplets, so, or contact with the mucus secretion. So since actually this bacteria is one type of normal beta, okay, 15% of population have that. So human is only reservoir, okay. Mm. However, so it's less likely that the reservoir can transmit this bacteria. It's more like the transmission happened from the patients. So Strep has more than 80 serotypes. Okay, so so the clinic uses the strep test kit. Okay, however, this kit has higher false negative. Okay, so that means if the test is negative, so that doesn't mean the patient uh, so that doesn't mean the patient doesn't have the strep. Okay, so that's why in clinic if the patient so the test is negative. So the test is negative. However, if the patient have a symptom, so the doctor still use antibiotics. So we also can do the culturing. Okay, bacteria culture. However, it's time consuming. Okay, so. Actually, so the doctor actually will administer the antibiotics without the uh, bacterial culture. Prevention, so no vaccine. Okay. Prevention. So good expression is hand wash. Hand wash. Okay. Um, maybe use face mask. Okay. So the treatment is penicillin. You can also use cefalexin for patient with penicillin allergy. Okay. Common cold. Common cold is very common. Okay. So several viruses can cause common cold, such as rhinovirus, coronavirus, adenovirus, respiratory syncytial virus. Okay. So the symptom transmission is through the droplets. Symptom would be sneezing, sore throat, runny nose, fever. Sinusitis can be caused by virus, bacteria, fungi, allergy. Treatment is antibiotics. If the agent is the fungi, we can use antifungi medication. Acute otitis media. So that's the ear infection caused by either virus or the bacteria such as Streptococcus pneumonia. Prevention, we have Prevna. Okay, Prevna. So treatment is antibiotics, tympanic membrane tube. So if so there are so there is too much fluid uh, accumulated in the media air, so we can do that. So we can see this diagram. So this is the infection. Infection causes the fluid accumulated in this area. So patient may have ear pain, fever. Diphtheria caused by the Corynebacterium diphtheria. Okay. So this is non-endospore form the gram-positive bacteria. Transmission is through the droplets contact, direct contact format. Okay. So the bacteria has exotoxin. So that's encoded by the bacteriophage. Culture is the tolerate medium. Prevention is the vaccine. Okay. Treatment, we can use antitoxin plus penicillin or erythromycin. So here, question. The use of the Prevna vaccine has reduced the incidence of which of the disease in children? I give you 5 seconds. So the correct answer is C. Okay, acute otitis media. Influenza. Influenza is very common. Influenza has caused huge number of patients every year and cause a number of patient dies. Okay, so this is a disease in the upper respiratory tract. It can also progress to the lower tract. However, most cases happened in the upper. So the symptom would be the headache, chills, dry cough, fever, runny nose, sore throat, fatigue, also secondary infections. So influenza A, B, C actually is the family of also mix or viridae. So this is spheric particle lipoprotein envelope stacked with glycoprotein spike. So that's hemagglutinin and neuraminidase. Um, so this is also called as H and N. So every year actually, so H and N changed. So that's why it's difficult to make vaccine. Because each year so the virus change the H and N, so the vaccine is difficult to make the vaccine every year to treat the specific influenza virus. So this is a single strain RNA virus. So each year, so the influenza virus change its H and N. So it is called antigenic drift. Okay. So you can change the amino acid composition. Uh, so the host cells cannot recognize them. So every year, so the influenza is new. It's relatively new to the host, so that's why it causes a huge infection. So that's why every year, so we have to make a new vaccine. So why it can change their antigen? Because since so they can change RNA information between different viruses. Also, so this virus has different hosts, so they can change with the host. Okay, so it causes pandemic spreading. For example, the virus can infect duck, human, and pig. Okay, so they can so duck virus has its own feature. Okay, pig virus has its own features, so they can change their features, and then so they came to human. Okay, so each year, so the virus change. So the virus can bind to the epithelial cells in the respiratory mucosa. Okay, can cause rapid shedding of the cell, cause severe inflammation, irritation in lungs due to the cytokine storm. So the glycoprotein and their structure are the most important determinants of the virus invasion and the diseases. So the transmission is through the respiratory droplets. Uh, so the contact with fomites is also one transmission route. Okay. So it's very easy to transmit this disease in cold, poor ventilation environments. Winter can facilitate spreading. That's why uh, influenza always happened in the winter. So each year causes maximally 60,000 people dies. So that's a lot. So the culture, we actually there is no value to do the culture. Okay, use time consuming is money consuming technology. So PCR is a very good method. However, we don't need to do the PCR. We just based on the symptoms, so we can make a diagnosis also. Uh, until now, so vaccine. Since the virus change every year, so every year we had to predict what strain of the virus can happen this year, and then make the vaccine. Anyway, so it's widely recommend. It's what so CDC still recommend everyone to get the vaccine. Treatment we have now we have the medication to treat this virus. This is Tamiflu, okay? Tamiflu. However, there is a resistance. We can also use the zanamivir, okay? Inhale the zanamivir to prevent the influenza. Amata Amantadine and rimatadine can also used as a prevention or treatment for the influenza. Whooping cough, pertussis, is caused by the Bordetella pertussis. It's through the respiratory droplets for the transmission. Incubation is 3 to 21 days, so it has two stages. Qatar stage. So the symptom would be the runny nose, 1 to 2 weeks. Paroxysmal stage. So that's a mm, mm, so that's a coughing. Okay, coughing is a symptom in this stage. Convalescence phase. So the bacteria decrease and then patient will get recovery. Okay, prevention is DTP vaccination. DTC vaccine. Okay, we can use the antibiotics. So the respiratory syncytia virus is caused the respiratory syncytia. So they can cause the upper respiratory tract infections. So the transmission through the droplets of the contact. For example, if the patient contacted the so if some people contact the patient's upper respiratory secretion, so they can get the infections. So the season would be the winter and early spring. Okay. So the premature baby and children 6 months or younger are susceptible. Okay. So now let's work on this question. Effective vaccine currently exists for use in nearly all populations against. So I'll give you 5 seconds. So the correct answer is E. Okay, it's E. Now let's talk about the tuberculosis. Tuberculosis. Actually, our human has very long history with these diseases. So it causes a huge number of patients die. Okay, also infections. So worldwide, 2.5 billion infected. So that's super. So that's too many people. Too many people infected. So the symptoms. Actually, since human can easily get infections. However, most people can get the immunity against these bacteria. So 85% case um, after infections, actually the so 85 tuberculosis can contain in the lung. Okay. So the clinic symptoms is the primary, secondary, and disseminated. So the primary tuberculosis actually is the first time for the people to get the infections, since this is the transmission route is through the respiratory droplets. So so the infection site is the lung. Okay. Once the bacteria colonize to the lung, so they can cause the tubercle formation. So this is necros cases lesion. Okay, cases, and then healed by the classification. So this is the neutrophil. So the so that's the agglutination of neutrophil and T cells. So the T cells, we can use the tuberculin reaction to see T cells reaction. So the extrapulmonary tuberculosis actually means so the tuberculosis spread to the other organs such as lymph nodes, kidney, lung, bone, and genital tract. So actually, this is a severe consequence that can cause patient death. Okay, secondary tuberculosis. So that's also referred as reactivation tuberculosis. So for example, if a patient gets the infection first time, in most cases, in most cases the bacteria will be killed and the patient recovered. However, in some cases, the bacteria is not killed completely, so they still stayed in the lung of the patients, and then so they can be reactivated. Okay. So they can cause chronic tuberculosis. So the tuberculosis can spread again. So it can form the cavity in lungs. Okay. So the patient. Actually the secondary tuberculosis is has severe symptoms than the primary. So the patient may have the fever, anorexia, weight loss, fatigue, chest pain. Okay. For this stage, the tuberculosis is very fatal. It can cause 30% death. So the causative agent is Mycobacterium tuberculosis. So this is acid-fast bacillus, strict aerobi. Okay, aerobi. Mycolic acid wax, because the bacteria has wax cell wall. So that's why this bacteria is resistant to drying and disinfectant. Okay. Also, since the bacteria has this type of cell wall, so many antibiotics cannot kill this bacteria. So we have used specific antibiotics. So in the AIDS patients, since those patients' immune activity is low, so they can get the Mycobacterium avium, okay, infections. So since the bacteria has the vaccine wall, so even the phagocyte eat this bacteria, so this bacteria can still live in the phagocyte, okay, can stimulate strong immune response. So the transmission is to the respiratory droplets. So if a patient has low immunity, so because for example inadequate nutrition, poor Medicare, lung damage or genetic or the disease with low immune system such as AIDS, okay, so they can easily get tuberculosis. So 2015, there are 1 million people died from tuberculosis. So that's still a lot. So America, so our country actually has very good public health condition. So that's why tuberculosis is very rare in our country. However, we still have the tuberculosis cases each year. 60% actually from the vulnerable person, from the immigrant. So the healthcare providers actually are at risk to get the tuberculosis infections. How to test tuberculosis? We can do the tuberculin test. This is also called the Mentos test. We can also do the interferon gamma releasing assay. Okay, and culture actually is not a good test. It's time consuming. Also it's expensive. Okay. However, if we have the patient samples specimens, we can do the acid fast staining on the sputum. However, sometimes we can get the result. Okay, so if the acid fast test is negative, so we cannot exclude the tuberculosis. So this is the tuberculin test. So we inject PPD to the patient's subcutaneously, and then we observe the skin reactions. Okay, so if the bump on the skin is more than 10 millimeter diameter, so we can consider that's positive. So the prevention, so so we have the vaccine, okay, BCG. So it's still used in the other country, however, it's not used in America. So the treatment actually we use the rifampin and rifapendin. Isoniazid, okay, isoniazid has been used for a long time. However, it's still very good medication for the tuberculosis. This is still the first line medication for the tuberculosis. We can here we can see we have also some others medication for our to choose. Okay. So actually, those medication has very good efficiency to cure the tuberculosis. So, however, the patient have to take this medication for long time. Okay, 9 months, for 3 months, 7 months. Okay, so so the big problem is no compliance. If patient miss taking some medication for a while, so that could cause the medication resistance of the tuberculosis. So the drug resistant tuberculosis is a huge problem in the world. Okay, so we if this happens, so we have to change the medication. However, actually, we don't have many medication to choose. Okay, so if this happens, the patient need treat much longer. Need to treat much longer. Okay. So, if patient has resistant tuberculosis, that can cause death, okay, more deaths than the patient without drug resistance. Now, let's talk about the pneumonia. Pneumonia, actually, we can, based on the symptoms, to make our diagnosis. So it can cause the fluid accumulation in the alveoli, okay. So we can make the X-ray uh, to visualize this on the X-ray. So many microorganisms can cause this can cause pneumonia. Okay. So 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 now, so we still have many cases in America. Okay, 2 to 3 million. Okay, 45,000 deaths per year. So this is still a problem. Even we have the medication to treat the bacteria. Okay. And now let's talk about the community acquired pneumonia. So the most important agent is Streptococcus pneumonia. Okay. And then is Legionella. And then is Mycoplasma pneumonia and Chlamydophila pneumonia. So this is caused the walking pneumonia. We talk about this later. Also the histoplasma capsulatum. So this is more related to the birds, okay, related to the patient who contact with the birds. Hantavirus can also cause the pneumonia. Pneumococcus is a small gram-positive flat coccus appear in pear. This bacteria can cause pneumonia in the elder people. Okay. Okay, in the patient who has low immunity, such as diabetes, or the patient has viral respiratory infections, or the alcohol abuse. Okay, so those patients can have the pneumococcus. Now we have the vaccine to against the pneumococcus. So it's recommended that all the people 60 years old should get this vaccine. Legionella Legionella pneumophila. So this is weakly gram-negative bacterium. So it is widely. So this bacteria widely exists in the water cooling system. Okay, SPA ponds. So this bacteria can survive even in the chloride water. So that's so that's why if the patient who have this this type of infections. So in the specific environment such as spa, okay, or the ponds or the cooling towers, so so they should be suspected to have this type of bacteria. Atypical pneumonia. So that means the patient doesn't have the typical pneumonia symptoms. For example, the agent causes pneumonia is mycoplasma and chlamydophila. Okay. Transmission route is also through the respiratory droplets. So this can happen in family, students, military. Okay, this is also called walking pneumonia because the symptoms is mild. Okay, symptoms is mild. Okay, patient may not have the fever, cough with may have some cough. However, it's not a lot. Hantavirus. Hantavirus is enveloped virus. Okay. So so this virus actually exists in the mice. So when the patient contact mice feck, saliva, so they can or urine, so they can get this infection. Histoplasma capsulatum. Actually, so it's widely. So it exists widely except Australia. In America, we have high incidence in East and Central America. So we can use a type of fungal extract to adjust to inject the patient to set up the diagnosis to detect if the patient have this bacteria. It's more like the TB test. Okay. Pneumocystitis giroversi can cause the pneumocystitis pneumonia. So actually, so it's difficult for people who has normal immunity activity to get this disease. Okay, only if the people's immune activity is decreased, so they can get these infections. For example, for the AIDS patient, so they can get this infection. So the traditional antifungal drug is no effective. Okay. Now let's talk about the respiratory virus. It's very common. Okay, cause infections. Uh, so the healthcare associated pneumonia. So this is related to the healthcare. So 1% of patients in the healthcare facility can get this pneumonia. So this is more related, associated with mechanical ventilation and through the uh, endotrachea tracheostomy tube. Okay, so mortality is very high. So this is also referred as ventilator-associated pneumonia. Um, so so the agent is the MRSA. Okay, MRSA, Streptococcus aureus, or the Klebsiella pneumonia, or the Interbacter E. coli, Pseudomonas aeruginosa. Okay. So we don't have to do the bacteria culture. So we can so we actually so for this patient actually, so we have to use antibiotics. We can use since bacterial culture is very time consuming, so we cannot wait the test. So we can observe the patient's sputum or the respiratory secretion to get our diagnosis and then use the antibiotics. So the prevention actually is so we can elevate the patient head to 30 to 45 degree to help the aspiration of the secretion, okay, and let the patient to exercise coughing, okay, deep breathing to reduce the aspiration, okay. So carefully clean and sterilize the ventilator, so the ventilator and the tubes. So if patient have the infection, so we have to administer the antibiotic immediately. Okay. Now let's work on this question. What is the leading cause of community acquired bacterial pneumonia? So I give you 5 seconds. So the correct answer is D. Okay. Streptococcus. So this is appendix. You guys can use this for your theory.